A new understanding of the genetics of cancer is transforming treatment.
We now understand that there are specific molecular abnormalities that can be found in each tumor, in each patient's tumor, that direct the way that we think about how that tumor formed and how we can treat that patient most effectively.
A growing number of cancer practices, like Dr. Trevor Bivona's, are sequencing a tumor's DNA to uncover its genetic abnormalities. The aim? To pair a drug with the specific mutation fueling a patient's disease.
The lives of patients with lung cancer and many other cancers have been transformed by this genomic technology, and the reason is because we've used it to deploy more effective and less toxic therapies for patients. So many patients with advanced stage lung cancer who are treated with one particular targeted therapy called Tarceva actually can derive significant benefit, and these patients often are able to carry out almost a normal life with advanced stage lung cancer. And so it's quite transformative for the lives of these patients. Because the cost of sequencing has come down and the sequencing technologies are much more powerful and can identify genetic changes in the entire genome of a human being or a cancer, this allows us now to deploy this sequencing technology in a clinical setting for use in patients, in every patient that walks in the door of our clinics. We're finding as we sequence more and more tumors across many different tumor types, lung cancer, breast cancer, colon cancer, even skin cancers, that many of the same genes are mutated across many different cancers, and therefore drugs that target those mutated genes can be applied broadly in many cancers. Although these drugs have dramatic effects and improve patients' lives almost immeasurably initially, there is the development of drug resistance which occurs in virtually all patients. And that is, again, a situation in which we have been and continue to deploy our genomic technologies to figure out exactly how the tumors have escaped therapy and become drug resistant. And in many cases identified additional mutations that can be targeted with existing available therapies or emerging drugs in a combination setting. But in many cases, we're not able to reach for an approved therapy off the shelf, but rather a drug that may be approved for a different indication or a drug that may be in clinical trials for a different set of or subpopulation of cancer patients. In that situation where we don't have an approved drug for use in this specific cancer indication or patient, there's a significant challenge to obtaining a drug for use in a patient. And those are challenges that have been an obstacle to getting patients therapies that the genetics mandate.
But such hurdles aren't dampening enthusiasm for what researchers are calling a revolution in cancer treatment. For the Wall Street Journal, this is Linda Freund.